Healthcare these days is kind of like a kaleidoscope, a collection of disjointed pieces coexisting independently.
One of the big issues in healthcare today is fragmentation of care. And by that I mean that patients can go to a number of different providers in a number of different settings to receive care. That's an issue because it can lead to duplication of testing, which is unnecessary. It can also lead to a person going into an emergency room for primary care. And the actual best setting for all of this to happen is in the patient-centered medical home.
Carolyn Gaughan is Executive Director of Kansas Academy of Family Physicians. In 2011, her organization launched the Kansas Patient-Centered Medical Home Initiative, funded in part by the Kansas Health Foundation. This three-year initiative's goal is an ambitious one, defragmenting the mosaic of a system that is healthcare.
Patient-centered medical home is a concept really in which we're just trying to provide care for a patient, coordinate their medical care, and everything really is centered around them, making it easy for them to get appointments, making it easy for them to know about their health information. Everything is done for them.
97.
So hopefully, as I'm coordinating that care, I won't be duplicating tests that other specialists have ran, or if a specialist needs access to a certain test, I'm getting them the results. Therefore, that's lower cost for the patient and lower cost for the system.
This practice is one of 8 in Kansas that is participating in the initiative, an effort that launched, among other things, a pilot project turning this Plainville, Kansas clinic into a patient-centered medical home.
Knowing what's going on is probably the biggest benefit. It'll be very beneficial that they'll have our history right in front of us and kind of know what to look for between my husband and I and our kids.
And the program's results are already speaking for themselves.
In this model of care, providers are able to look at standards and compare their practice in such a way that they actually improve, for instance, the number of patients that they are screening for preventive issues. One of our practices has increased and found more cases of cancer at an early stage when it can be effectively treated and lives can be changed than they did prior to participating in the program. And so that's just one very extreme and very important example of how it impacts the lives and can change the lives of the patients and even save the lives of some of the patients involved.